Now to a health alert. For many years, women have been told, get regular mammograms to help reduce the risk of breast cancer. But a new study out of the Netherlands is challenging that. Researchers followed thousands of women in Denmark and found that maybe a third of what was detected by mammograms may never have caused health problems. And it concludes that breast screening can lead to unneeded treatment. Let's talk about that with Dr. Scot Ackerman from the Ackerman Cancer Center. Good to have you here.
Thank you, Bruce.
Does this study raise the uncomfortable possibility that some women who actually believe their lives were saved by mammograms were harmed by the cancer treatments?
The study certainly raises that possibility. What the study found was it looked at two groups of women, one group that was receiving mammograms on a regular basis, annual or semi-annual basis after the age of 45, and another group that wasn't receiving mammograms. And they found out that the two groups had a fairly similar incidence of late-stage breast cancer or large breast cancers, meaning breast cancers greater than the size of 2 centimeters or about a nickel. So each group had equal number of tumors of that size, but the group that was getting mammograms had a higher number of tumors that were small, which weren't found in the group that wasn't screened. And so what they postulated, or what they've inferred from this, is that mammograms find more cancers, but it finds many cancers, not more cancers to prevent, it doesn't find cancers to prevent diagnose them at a late stage, but finds more cancers that are diagnosed early, and maybe those women would never advance to larger cancers. Maybe those tumors would never become life-threatening.
So maybe there's some unnecessary treatment.
Correct. So maybe we're finding cancers that would resorb on their own or go away on their own or never progress to become something that's life-threatening. But the other side of that is it's good knowledge for women to have if they have a tumor. We are identifying now better than ever who needs treatment and who doesn't need treatment. We're finding ways to treat with less. We're doing less surgery than we did years ago. We're not doing mastectomies like we used to. We're doing lumpectomies now. When women need radiation, we're finding ways to give radiation to only part of the breast, what's called partial breast radiation, so as not to cause damage. We have new tests now that look at genetic malformations within cancer cells to help identify who needs chemotherapy and who doesn't. So we're not treating everybody with breast cancer if they're diagnosed with early stage breast cancer. We're not treating them as aggressively as we had in the past. So to not get screened, you don't really know what you have going on, but if you do get screened and you're in that group where we're finding more early stage breast cancers, we're able now to identify who really needs treatment and who doesn't need treatment.
And I know that there are some doctors who say, you know, let's put this in perspective here. This study was relatively small, number one, and number two, the results and what's coming out is just going to serve to confuse women.
Right. There's a lot of confusion from this. And in fact, there was another Danish study a few years ago that showed that also showed that cancers were diagnosed more early, but no difference in later diagnoses. But that was only about 2 or 3%. So it makes it confusing. This also in Denmark, 2% versus a third of the patients. How do you know what to believe? You want to see studies that show consistency over time. And it does confuse the matter.
So is the bottom line here, get that proverbial second opinion. If there's consensus, go ahead with the treatment. If there's a bit difference of opinion, maybe seek out a third.
Well, I think it's very important to know what you have. I think that ignorance is not bliss in this case. I think it's good to be screened. But once you are screened, and once there's something there, it's important to have a meaningful conversation with your physician about what treatment you may need. You know, we saw this in prostate cancer. In prostate cancer, we've been de-emphasizing the PSA screening. What we've seen now is that the incidence of metastatic prostate cancer in men over the age of 75 has doubled in the past 10 years as opposed to before that.
Actually, I think it went up 75%. So yeah.
It went from 6%, right, about 6.5% to 12%. It went up a lot, that incidence of metastatic prostate cancer. That's because we've de-emphasized PSA screening. I'm concerned if we de-emphasize mammography, we're going to see women diagnosed with breast cancers that can't be treated.
Take this information with a grain of salt. Certainly ask questions and make sure that whatever is, you know, in your future is best for you. For the latest health headlines, head to newsforjax.com. You'll find this entire interview on the morning show page, posted about 10:30, 11 o'clock this morning. Doc, always a pleasure. Good to have you here.